Hi, everyone. Welcome to our fourth episode of Teal Table Talk, which is a series that we're doing here at the Spina Bifida Association as part of our virtual walk and roll and resource fair for the month of July. So I'm your executive director, Jean Bertschmann, and I'm very excited to welcome you to our conversation tonight about spina bifida and fertility and how to start a family. So thank you for joining us. I want to start by thanking our sponsors who provide funding that make this and other programming possible. Our silver sponsor is Coloplast. Our bronze sponsors are Boston Children's Hospital Neurosurgery Foundation, Mass General Hospital for Children, Hollister, Permobile, Mobility Works, and our friend level sponsor is National Seating and Mobility. So thank you very much to them. So I will do quick introductions or ask people to quickly introduce themselves and go around, and then I will turn this over to our moderator. So I'm going to start by asking our moderator, Akira Byas, to introduce herself. So Akira, if you could say hello.
Thank you, Jean. So as she mentioned, my name is Akira Byas. I'm the graduate student intern for the Spina Bifida Association of Greater New England. Over the last couple weeks, I noticed that there were certain gaps in research, and that's pretty much like what my focus is in my program. I look into health equity, racial disparities, and I kind of wanted to bring it home and give people an opportunity to have conversations surrounding that. So this is an area that I'm really focused in. So I'm really excited to have this conversation.
Thank you. We're really lucky to have you. Dr. John Harris.
Good evening. My name is John Harris, and I am the director of the UPMC Magee Women's Hospital Center for Women with Disabilities. It's a center that's been around for now 20 years, caring for people with intellectual or physical disabilities, providing general women's health care. So I care for women from kind of older adolescents up until their 90s. I don't think I have any 100-year-old patients, but I would like to. And our goal is just to provide, excellent health care and health education for women with disabilities and all the needs that they have throughout their life.
Thank you. Dr. Heidi Leftwich.
Hi, good evening. My name is Heidi Leftwich, and I'm a perinatalogist at the University of Massachusetts. So essentially that is an OBGYN provider who has trained to take care of women who have high-risk conditions. So that can be medical conditions, that can be prior pregnancy or complicated pregnancy conditions. And I care for women in the preconception counseling, which we may get into a little bit tonight, where we talk about and we plan for a pregnancy, as well as the actual prenatal care, and then delivery and delivery planning. So kind of throughout the pregnancy and pre-planning pregnancy time and postpartum care for any women with any kind of complication, which would include physical disabilities.
Thank you. The rest of our panelists are our board members and proud parents. So I'll introduce them and ask them to tell us a little bit about themselves and obviously brag about their children. So Brendan Sullivan, if we can start with you.
Sure. Good evening. Brendan Sullivan. I'm a member of the Spina Bifida Association of Greater New England Board. Been associated with the organization for about 20 years on the board. I am an adult living with spina bifida, 42 years old. I have a wonderful wife and a beautiful 7-year-old daughter, Emma, and here to, I guess, provide the male perspective in this conversation.
The Lone Ranger. Amy Richards.
Hi, I'm Amy. I'm 30 years old. I live in Methuen, Massachusetts, and I'm the vice chair of the board of directors for the Spina Bifida Association of Greater New England. And I live with my husband and our 10-month-old son, Oliver. And I'm excited to be here to share my perspective.
Thank you. And Kristin Marquis.
Hi everyone, I'm Kristin. I am from Portsmouth, New Hampshire. I'm an adult living with spina bifida. I'm 38 years old. I live here with my husband Matthew and our little daughter Louise. She's 2. She's fearless and sassy and smart and fun. And I hope she's not running around back here at any point during this presentation. But if she is, I'm sorry.
That would be lovely. And Lauren Dyer.
Hi, I'm Lauren Dyer. I am also on the board. Um, I am 38 and live in Nashua, New Hampshire with my husband and our 2 kids. We have a 7-year-old daughter named Mayabel, which she asked me if her name was going to be mentioned, and I said probably not, but she'll probably watch this. I'll show her the beginning of the YouTube video so you can see her name on YouTube. And our 5-year-old son, Beckham. And I'm an adult with spina bifida, and I also am a wheelchair user.
Excellent. Well, thank you all. I am going to change the view so you can see the speaker and the questions, and I will turn it over to Akira to take it from here. So Akira, go ahead.
Thank you. So for the first question, this is for Dr. Harris, and this question stems from Hollow et al. From an article written from the American Academy of Pediatrics, and they're dedicated to the health of all children. So in their article, sexual health is the state of physical, emotional, mental, and social well-being in relation to sexuality. With that in mind, why do you feel as though sexual health and sexuality are not often talked about for topics among people with disabilities, specifically those with spina bifida?
Well, thank you. That's a great question. So, to start out with, there's obviously a lot of daily concerns that individuals with spina bifida address all the time and are always in the front of their mind. So when I think about, we think about preventing UTIs, preventing pressure injuries, making sure that joint health is really good throughout life, and independence is great. So avoiding arthritis, watching weight, watching out for osteoporosis, and maintaining mobility throughout life, watching out for neurogenic bladder or bowel issues. These things are all daily concerns. However, all individuals also have other life goals that they may have around planning for parenting in the future that may not be on people's minds every day. And so these are things that can be challenging to address in the midst of other maybe more pressing concerns, especially among their healthcare providers. So physiatrists that see individuals with spina bifida routinely report that they simply just don't have time to make it to traditional reproductive health concerns of men and women with spina bifida. Now, once we were to get to that point, there's actually a new challenge, and that is that providing that care, there's a number of kind of synergistic problems that make care more difficult. So first, simply, it is more physically demanding to do, especially reproductive organ health care than other organs, because people, if they are wheelchair users, will have to get out of their wheelchair. We need to have access to a Hoyer lift and all sorts of things to make sure that we can care for people safely. Next, there's going to be a need for special space in clinics, for enough space in bathrooms to give urine samples, and all other things that may not be available other places, also making it more difficult to receive traditional reproductive health care. Now, next, this is a sensitive issue that you want to trust your provider. And so it's hard to meet a new provider and to talk about really sensitive questions around parenting plans, concerns, anxieties, hopes and dreams around all these things. Very, very tricky. Now, also, pregnancy culturally is considered an optional condition among healthcare providers. So that means that there may be a challenging discussion between individuals that may have conditions that providers may be concerned about. They may be concerned about the risk of spina bifida in a child, or they may be concerned about the risk of blood clots or other things. But and so sometimes say, well, maybe it would be better not to be pregnant. So the optional nature actually makes the discussion more difficult rather than, I think, easier, because there's always a way of kind of getting out of the discussion rather than kind of staying in the plans of the individual that has a parenting goal. Around in our medical community, there's a strong focus on health and kind of avoiding, kind of having the perfect delivery, avoiding anything that's considered a birth defect. And so all these things make it, I think, more challenging for individuals that are living with spina bifida. And then finally, unfortunately, obstetric providers are often very risk averse and avoiding medical legal conditions. And so I think that for some individuals, they're simply not comfortable with the condition, and they're worried about the risk that they take on caring for it. So all those things together make it a very challenging area.
Thank you. So for the next question, I wanted to ask, do you feel as though your doctor or other professionals, and these are for our board members, provide adequate education surrounding your sexual and reproductive health throughout your adolescence, and into adulthood? If so, how? And if not, what do you wish you could change? Also, as a follow-up question, how was sex education handled in high school or school in general? And what would be your suggestions regarding how it could be improved?
So I'd like to start to answer this question. Growing up, I always had male doctors, especially the specialists in when I attended or went to Children's Hospital in Boston. And looking back, I do feel like it was definitely addressed, but I don't feel like it was addressed in a way that actually made me feel comfortable saying anything, unfortunately. On one hand, I do think it was a positive thing that it was brought up. My doctors never made it seem that I couldn't have, a loving relationship with someone someday. They were very positive about the fact that I could have a family someday. You know, just with like fertility aside, who knows what's going to happen, as a woman, you might, or even with your partner, you might not be able to, but physically with the spina bifida, it didn't seem to be a problem to them. But at the same time, it was brought up in a lot of appointments when my mom was there. And basically I felt like it was brought up in a way where I was asked if I had any questions, and you don't know what you don't know, especially as a teenager. It was just uncomfortable. And at the time, growing up, my pediatrician was also a male, so it just didn't feel like there was that space being given to make sure that it's a comfortable place for the patient. It just didn't feel like there was, it felt like if it was a designated person that could come in, or, if they set it up in a certain way that would be comfortable for the patient and the provider, I felt like that would have worked out better. But like I said, it was never brought up in a negative way, and it wasn't ignored. So that's good. In school, I do feel like our school system, and I think this is common across schools, but abstinence was very pushed, and anatomy, I felt like, was very focused on. But looking back and now having gone through the whole process of trying to get pregnant and, fortunately being successful in that, I've realized that there was a lot I didn't know that I should have known. A lot that maybe should have been talked about more, instead of, I felt honestly like they kind of scared us in high school. Don't do it, because it's all about preventing, getting pregnant, having a baby. And instead of focusing on planning in the future. So that was my experience.
I'll echo Amy's comments. My mother was always in the room when I was having a conversation with a doctor, with that, be it an orthopedic, neurology, or urologist. So those conversations did not come up in that environment as a teenage boy. And similar, I think, as you enter adulthood and start to meet with your primary care, at least from the male perspective, the health piece of it isn't as, I think, top of mind until you're ready or thinking about planning or having a family. And frankly, in my experience, I remember two things in the entire kind of preparation or medical piece of it, other than, the first comment being, obviously you're a carrier of spina bifida, therefore your chances of having a child with spina bifida increase, X-fold, and frankly, I forget what that statistic was. And really the only advice I ever received as a male was make sure your spouse takes X, a ton of folic acid, and you can't have an unplanned pregnancy because you risk a higher potential for passing on spina bifida. your spouse needs to have, 6 months of increased folic acid before you really begin that journey. And so as a male, that was really the only advice I was ever given, and the only part of the process that I felt I could be involved in. Obviously, a lot of education for my wife, who does not have a disability, does not have spina bifida, but did work in the medical profession or the medical field in an administrative role. So I think was comfortable with part of that conversation, more so than maybe others would have been. But as a male, it really was just that, make sure your spouse takes some folic acid was the only advice or education I really received.
Awesome, thank you. So for the next question, anyone can respond to this, but it's looking back on your experience. What do you wish you had known before you began your family, and what advice would you have for people just beginning their journey?
I think I'd like to start, if that's okay. I think sort of basic things that I wish I'd known before, well, kind of piggybacking off of what Brendan just said about folic acid. And I unfortunately, when I started trying to have a family, wasn't spoken to ever about even if I could get pregnant, if I should, and what that would look like, what potentially my body may or may not do. So I got pregnant. And before that, I wish I had known those things. So I was put on the folic acid, but needing to see genetic counseling or maternal fetal medicine, or none of those things were discussed with me, unfortunately. But one of the biggest things that really surprised me, and this was my experience and it might not be everybody's, was mental health during your pregnancy is so important and not talked about enough, especially amongst women with disabilities. And I tended to feel throughout my life that I wouldn't know if my body would be able to do these things. Would it fail me like it does with other things? And that really, for 9 months that you're carrying a baby, is a load. It's a lot. And so it's really important to not only see maternal fetal medicine and all the other very important things for you, for your physical well-being and your baby, but I do think that your mental health aspect is something that you should really consider taking really good care of ahead of time as well.
Thank you for your honesty. I really appreciate that. So this question is for Dr. Leftwich. I wanted to have a different perspective as far as like preconception and prenatal care. So I kind of wanted to circle back and ask you the same question that I asked Dr. Harris about, with that in mind, why do you feel sexual health and sexuality is not often spoken among people with individuals with disabilities, specifically spina bifida? So what would you tell Kristin in that particular situation?
Thank you for the question. I wish I had a chance to have met her prior. As a maternal fetal medicine doctor, part of my job is to normalize conditions and to try to get everyone kind of on a same playing field of being able to have that mentality of, can I do this? Can my body do this? And to be that supportive person to say, yes, your body can, and yes, you can, and here's how. It might look different. It might take some additional things or pieces here, but here's how it looks. And so to bring it back to kind of your original question, I think we have to start earlier. We have to normalize it early, where you talk about either preventing pregnancy. Kristin brings up a valid point. If you're not planning on getting pregnant, then maybe we should stop pregnancy, because sexual relations are normal and can be normal and can have, a really wonderful impact on a relationship, even if you're not planning pregnancy. And so that has to be normalized. But then, that's not exactly what I do for a living, but that is the beginning of what we do. And then to have the planning part where you talk about the folic acid. And honestly, if everyone could have a preconception counseling visit, you could go to someone who you felt comfortable with, who mom's not in the room, who you come for the discussion of how is this going to look? I have questions, or maybe I don't even know that I have questions, but can you sit with me and walk me through how I'm going to get up on the exam table or not? How am I going to have exams in your office? How am I going to give a urine? How do I get here? Do I have a partner come with me? Like, what does this look like? What are my risks to a pregnancy? You know, we talk about being risk averse, but really, like, what are the risks? What help me make the decisions that I'm making? And what does this look like? And so I think it's really important to normalize and to bring sexual health and sexuality to the conversation. But people have to have a comfortable place to do so, right? And so I've heard from a couple of people that, yes, it was kind of brought up, but my mom was in the room. We have to give people the space to discuss. We have to do better. And part of the effort of tonight, and part of the effort just in general, is to bring that to the table and say, let's give you a space to discuss. Let's bring that space for you. And again, my office is kind of directed towards that type of care. But some people don't even know it exists. I mean, some people don't know what a maternal fetal medicine specialist is or does, or that there are any in their area. Or that you could meet them before you're pregnant. I mean, I have so many people that come to me pregnant who said, oh, I wish I knew that you did something prior. If we don't even know what we all offer, how are we supposed to offer that? And so I think getting it out there that we are willing to meet with people early. I mean, I would love to meet with every teenager who would even be looking at a pregnancy, just to offer them the ability to think about it, to talk about it, to normalize it, to say, this is what it could look like. If you're ever interested, cycle back with me if you are, here's, the conversation that you want if you're not. And I think that part is not exactly what you asked, because you asked, why don't we? I think we don't sometimes because people aren't confident or comfortable discussing things. We had a little side conversation before that I think it's really important that we learn from our patients. Even if you don't know, if you would just ask, someone will tell you, what are your limitations? How can I help you? Those are really powerful words, even if you don't know specifics about what someone's struggling with. If you would just ask, you could probably find a way to better help them. And so I think, a lot of people don't ask because they're uncomfortable, because they don't have as much specific knowledge. They're scared to be asked something that they don't know the answer to. And I think we honestly just need to do better and just listen to our patients and learn from them. And then I guess just to have like one other second, you kind of asked the what advice you would give. I would cycle and kind of end with the fact that I would say early is better. Come when you have questions, reach out, ask the uncomfortable question, even if it's not the time, and even if the provider didn't bring it up, bring it up. We're always happy to answer things. If someone had a question, I would be just devastated to know that they walked out of my office and didn't ask. So I think it is our job to give you a comfortable space to bring up anything that you'd like. But I also would ask that, please, if something's bothering you, please bring it up, because we would want to know across the board. So my advice would be to ask all the questions, ask for help. And if you're not getting the answers that you want, maybe change and find someone that will help you better.
Thank you, Dr. Leftwich. So I wanted to ask Amy the same question. So what do you wish you had known before you became a family, and what advice would you give someone else who's starting that journey?
So fortunately, I did know of, or I did find out about a maternal fetal medicine program near me, actually thanks to Kristin on the board here. And so my husband and I did meet with a specialist at a hospital in Boston before we started trying. So it was well ahead of time. I had a whole list of questions. He had a whole list of questions. And we, for the most part, got them answered. We left the appointment, unfortunately, not totally confident, and it was because the specialist wasn't totally confident. And that didn't surprise me, but it did disappoint me. But we were left with, basically the decision was, how bad do we want this? Do we want to make this happen? They never said it wasn't possible. They just basically said it's going to be hard. And I knew that. And as a person with a disability, you know that it's not going to be easy, but you have to think about, okay, what resources do I have at my disposal? What support system do I have? Is this, can I do this? Can my body go through this with me? And like Kristin said, you do have to put a lot of trust into your body, and that is very uncomfortable. At least personally for me, with my disability, you're not used to trusting your body. You're not used to trusting that things are going to be okay and things are going to go smoothly, because that's just not our experience usually. And so that was really hard, and that was really hard on my mental health as well. Fortunately, I did already have some things in place with that. I had a therapist already, and a great support system, but it's still hard. There's no, you can have a safety net, but it's still always going to be hard. If I could also just add to, I have a perspective, I guess, that I wanted to offer for the first question as well, where, why do we feel as though sexual health and sexuality are not often talked about? And I guess my point of view on that, and this is coming from my personal experiences, but also discussions with other women with disabilities. And it feels like there is just still that stigma of, we are not sexual beings. We are not expected to be successful. We're not expected to be independent, fall in love, have someone fall in love with us. And that's a societal thing. And it's definitely in the health professional field. There are some great professionals. We have them here. There are people with it on their radar. There's a lot of people that don't have it on their radar. And something that you brought up, Dr. Harris, even the fact that medical buildings aren't always set up for people with disabilities, people using wheelchairs, that right there kind of shows it's not thought of. It's not going to be on the forefront of people's minds now. And we have a lot of work to do. And it can't always be, the responsibility of the patient, the responsibility of the person with disabilities to educate our professional. What we're really looking for, and I wish I had, was a specialist I could go to and they could say, I've worked with, X amount of other women with spina bifida or a similar disability, and here is what has happened, or here was their experience. Instead, I was met with, I haven't come across this, but I'm willing to help you. And there's a huge difference between I'm willing to help you and I am experienced enough to be confident in helping you. And I don't know, obviously I don't know how to fix that, but I think it's a conversation that needs to be had, and there are huge changes that need to be made, in my opinion.
Thank you. Yeah.
Thank you.
No, of course. So for this next question, this is for both Dr. Harris and Dr. Leftwich. What reproductive health advice do you have for women with spina bifida who want to be mothers in the future?
So, Heidi, maybe the way we can do this is I can talk about some of the relational things, and you can talk about the medical side of things. And so I'm going to first start out with let's call it the ideal state. Now, many people will have unplanned pregnancies, and this is going to need to happen much faster. But in the ideal circumstance, we would love people, first, I want to encourage everyone to discuss parenting plans with their providers anytime that they want. We know that one of the biggest barriers is that people we don't provide a discussion and education about these things. And so that leads to that sense of being an asexual being rather than asking about it frequently, or just asking about contraception and not asking about parenting, which is almost just as bad because it just makes it seem like it's only a negative. So you want to have a good relationship with, say, whoever you would say your primary care provider is. But if you're considering getting pregnant, my hope is that you would also discuss with hopefully your whole team of doctors. So your neurologist, your urologist, your physiatrist, if you have one, because we want to be prepared for the changes in your bladder health changes. If you have concerns about, a history of shunt problems and things like that, and being ready for any changes that you may need in any sort of accommodation or wheelchairs, because people's bodies are changing throughout. So having those relationships ready. Next, remembering that it may be challenging to find a obstetric professional that feels comfortable with your care. Now, that starts with you may need to find an infertility doctor. 15% of all couples have infertility, and that is something that we run into. And it would not be surprising if I ran into someone with spina bifida that also had infertility, and we're prepared for that. So rather than seeing that as something that's a game changer and just like, well, I can't do it, just remember that that's unfortunately a challenge that a lot of couples deal with. But finding an infertility doctor may be especially difficult. There's unfortunately really sad stories about people with physical disabilities that have a lot of difficulty getting an infertility doctor who's like excited about helping them with a parenting plan. Finding an obstetric provider, as Dr. Leftwich already discussed, is really important. And so you want to create these relationships. Now, a few other relationships I want to talk about before we end up is that there might be some difficult relationships. So relationships that people often describe as difficult are relationships with genetic counselors. So you will almost assuredly be seen by a genetic counselor with a history of spina bifida. And genetic counselors are great professional individuals, but they sometimes are challenged in understanding the lived experience of people with conditions that they talk about all day long. And that can be pretty insulting to people that have those conditions. And when you hear how they're described, whether that's families with individuals with Down syndrome or with a mobility disability, any of these things, there's a long history of having a lot of very sad interactions, a lot of very hurtful interactions. And so you want to be prepared for some challenging things. Another area of challenging, just besides general obstetric care, is the labor and delivery experience. And of note, I think it's fascinating that when I've talked with women, the most challenging part of their experience is frequently postpartum care. So they make it through this whole super stressful process. And then you go over to postpartum, and it's hard to describe what postpartum care is, but it's very much like an assembly line. Learn how to do these things. And these postpartum nurses are not going to have any experience with what you do. And they are a little bit busier than your labor and delivery nurses, when you were delivering. And for all those reasons, people frequently feel like I'm not getting the care that I should get. So unfortunately, you have to advocate for yourself throughout the process. And then the final thing is that some people don't feel comfortable with their parenting capability. I mean, I unfortunately hear women over and over say they're concerned about once their children become toddlers and they start moving in ways that maybe they do not move, that there's going to be some tension there. And so having a social network, being able to talk with providers, being able to talk with loved ones about what the plan will be is all important. And those are just all relational things outside of the medicine.
And so I guess that's a good point. We'll try to add kind of the additional component, because I agree with all of those challenges and all of those things. Preparation is key, but sometimes we don't have the ability to be prepared. We have spontaneous pregnancies that are unplanned all the time, and we should be able to handle them as well, right? So we can talk about planning, and planning is always great. But a lot of my life is, we didn't plan, here we are. What do you know? What can we do? And so I would also echo the postpartum arm. I think, when you find an obstetric provider that is comfortable with spina bifida, physical disabilities, any kind of, things that are going to make a postpartum stay more challenging or at least a little bit different, I think planning the postpartum aspect is just as important. And so part of what I do is create kind of a labor and delivery plan and then postpartum plan. And again, that's just provider and hospital dependent on what you can do, but you can select different things for different people. Sometimes we have different postpartum providers that would take care of, and nursing that would take care of certain patients, and we will have that set up and care plans. You write all these care plans. It's not perfect. It never is. But at least if someone anticipates the needs that you might have in advance, they can at least know a little bit more about you and not have to walk in the room and say, okay, so what do I do here? Because that's awkward, it's uncomfortable, and it doesn't feel like you're being cared for. From the standpoint of the pregnancy itself, there's a lot of talk about bladder function. That typically is one of the things we struggle with the most, is the risk of urinary tract infections and what to do with that. But spina bifida is just like anything else. There's like a huge, lovely, big group, and not everybody fits that mold. And so honestly, you can talk about urologic injury, you can talk about urinary tract infections, but someone else might struggle with, seizure disorder and VP shunting. And so there's different concerns that you might have. So depending on the patient, those things could be a little bit more challenging during a pregnancy. So I would say that the multi-provider discussions, and we love to have kind of big discussions with multiple different providers, is always good, because the VP shunts have a chance to move with a growing uterus. And there's sometimes concerns, again, with urologic either injury or infection. We want to look at your medications and make sure there's none that are specifically what we call teratogenic, or something that might physically harm a growing baby. And so if we can alter medications, if you're having active seizures, if we had time to do it before pregnancy, we would like to adjust medications to make sure that you're not actively having, or as we can at least optimize the amount of seizures that you're having. Depending on mobility and the ability to have a vaginal delivery, if there's any kind of concern about the inlet or the ability to have the baby fit, we would want to kind of check for that early and then afterwards as well, because again, your pelvis will change with the growing pregnancy, but there's a lot you can learn from kind of early on. A lot of people talk about cesarean delivery being like an absolute must, and that's just like a painful thing for me to hear, because that's actually not even remotely true. And so I think, people stem from lack of knowledge and say, well, that's probably the best thing to do. And what's really in the data is that unless there's a specific reason for that, that's actually not what's best. In fact, it would be worse because of the risk of potential injury or postpartum complication. It's a little bit harder to move around after a cesarean delivery. And so just all of those things to discuss and think about, but definitely finding someone that's comfortable with your condition is something that I feel like is difficult, but is so vastly important. Again, I think it was Amy who brought that up, and I apologize if it wasn't, but I think that's so important, because honestly, as much as we all can try, experience is really important. And with something that's rare and becoming hopefully less rare, we can try to find people who have at least taken care of someone and has something to tell you other than just what they've read in a textbook. So we can try and always be better, but I definitely think finding someone you're comfortable with is a huge aspect to it.
Excellent. Thank you so much, Dr. Leftwich and Dr. Harris. So to kind of switch gears a little bit, I'd like to join Dr. Long-Bellil to the conversation. I wanted her to introduce herself before asking the specific question, and so we can all be familiar with who she is. Dr. Bellil?
Thank you. Thank you very much. I apologize for being late to the conversation. I took the day off from work and so didn't check my calendar this afternoon. So anyway, so I'm on the faculty at UMass Medical School, and I work, one of the people I collaborate with on some of the research we've done on women with reproductive health of women with disabilities is Monica Mitra. I think Dr. Harris, you're probably familiar with Monica, and some of the rest of you may also be. So that's a little bit about me. I do a lot of medical education, and in addition to teaching in our LEND program, leadership education for people interested in the disability field, and other kinds of social science research as well. So that's me in a nutshell.
Thank you so much. I'm so glad you brought up your work, because my next question is geared towards that. So in your publication, The Impact of Physical Disability on Pregnancy and Childbirth, you explored the impact of women's physical ability on their health and function during pregnancy, as well as their expectations during labor. Do you feel pregnant women with disabilities are protected under the present health policies? If not, how could this be addressed?
Well, speaking of medical education, having some content about disability and pregnancy required to be part of medical education, or even just having disability being a required part of medical education, would be a big help. That would be a really good start. And there's currently no requirement that disability, any education regarding caring for patients with disabilities is required for the general medical school curriculum. So that would be one thing. The other thing is that I think often with women with disabilities, a team approach is very useful. And that is not necessarily encouraged by our system. It's not necessarily reimbursed very well by our system. The time that it takes to coordinate with other clinicians et cetera, isn't necessarily paid for. And I think it would help if it were, because I know a lot of times the obstetrician needs to collaborate with the urologist, or maybe a neurologist, depending on the situation. So I think that those are some ways in which our system really does fall short. So.
Yes, thank you. Thank you. I agree. To kind of switch gears a little bit, I want to go into sexual function and fertility. So the question is directed towards to Lauren Dyer. I wanted to ask, based on Stewart et al., it disclosed that by the age of 23, about 48% of women with spina bifida are sexually active. Additionally, Game et al. Mentioned that urinary function may impact sexual function. Did your provider ever discuss sexual health or fertility differences among women with spina bifida with you? And how were you able to inform yourself about starting a family?
So growing up, originally, my mom, I guess, had asked the doctors for years, over and over, since I was a baby, then middle school, teenager, if I could ever have kids. They never gave her an answer. They wouldn't say yes or no. They just kind of were like, we don't know, and just wouldn't answer her. So I kind of then, most of my life, I was like, I don't want to have kids, because I wasn't educated. No one ever educated me about the differences or if I could have kids. And so I kind of had it in my head, I'm not going to have kids. I don't know if it's genetic. I don't want to have a child that has to go through all the surgeries and stuff that I did. And then I met my husband, and still and then we met, year later, got engaged, then we're planning a wedding, still didn't know if I could have kids. We decided we did want kids. So I was 29 and we made an appointment with my doctor that I was comfortable with at Children's Hospital, who I hadn't seen for a while. And we were like, so what's the deal? Can I carry a baby? Can I get pregnant? And he was like, I don't see why not. And I was like, well, why didn't you answer my mom all these years? So that was that. Fortunately, my husband's a nurse, so that kind of helped with then the next step. So like I said, we kind of just had to inform ourselves about starting a family and do our own research. We knew we wanted to deliver in Boston, because in case anything was wrong, we wanted to be there near Children's Hospital. And so then we started weighing the different hospitals, which one should we go to? And so we decided on one, and before getting married, we went and met with the high-risk doctor to talk to them and ask a few questions. I was on a medication at the time, and that was a Class C drug. And so I wanted to find out if I should go on something else, and then ask about folic acid. So it kind of ended up well, I don't know if you'll be considered high risk. Folic acid doesn't really, we don't think that the folic acid will prevent much in terms of with people who already have spina bifida. Yes, it prevents it, but he didn't believe I had an increased risk, but he gave me a prescription for higher doses anyway. So I took that for about a year. So then we got married, decided to start trying, and so I was on that. But everything was kind of just, I guess, trial and error with the first child. For the second child, my doctor then treated me like anyone else. I was like, shouldn't I be considered high risk? And she said no. And I was like, well, do I need to have a C-section? She said, well, the body doesn't produce a baby that it can't deliver. So I was planning on having a regular natural birth. And it turns out I ended up having to have an emergency C-section because of the way my daughter was. She was transverse. And they learned during the C-section that she wouldn't have fit. So it ended up being I just feel a lot of things then also I was given a room that was not wheelchair accessible, and my wheelchair couldn't fit in the bathroom. I found out on like day 2 or 3 after having the baby that they had an accessible crib that lifted up from the side that no one told me about. And I didn't know that was something that I should have researched beforehand. It was just kind of a lot of things that then I was able to advocate for myself. I also had complications following the C-section, my first C-section, and I wish we had asked more questions, but we didn't know. Like, I think someone else said it, like, you don't know what you don't know. And so if the doctors are inexperienced, even at one of the best hospitals in the country, then what do you do? So yeah, that was my experience with that.
Thank you for sharing. Brendan, do you mind giving the male and only perspective in regards to sexual functionality as well as fertility? Like, what was that conversation like with your provider?
You're assuming it happened, Akira.
I am assuming it happened, yes.
No, I think, and credit Amy for what she said earlier, and I certainly had the same feelings and don't want to speak for others here, but there's that self-conscious or self-doubt, if you will, being an individual with spina bifida. And, I thinking about this session before tonight, there's no part of my life where I've ever felt that my disability has held me back or I've allowed it to hold me back, except for in a relationship, finding a spouse, romantic, any part of that. That's the one part where you just kind of feel like, I don't know how to feel about this, or how, more importantly, how somebody will feel about me. I referenced it earlier, and though she was on the administrative side, I find it appropriate that I ended up marrying somebody in the medical profession. And I know, Lauren, you mentioned that your spouse is a nurse, so it just seems natural to me that happened, or it was destined to be that way. But for me, there weren't those conversations. I guess more so just kind of that explanation to a spouse or to a potential partner about what is spina bifida, and what are the impacts. I am ambulatory. I wear a AFO on my left foot only, or my left leg. So in terms of an outward sign of it, it is somewhat mild, though noticeable. So I think you're just right, wrong, or indifferent. Visual perception is maybe kind of the first point to an attraction. And I'm fortunate that somebody self-selected into me, if you will, and thought about that, or thought about me before they thought about that, I guess is the better way to say that. So I think that's an important part of finding yourself and trial and error, and going forward in that way. So that's the male perspective I can offer.
Thank you so much. So to switch back to both Dr. Harris and Dr. Leftwich, I want to talk about, according to Akira, placing the responsibility of sexual health in the hands of patients, as we've seen with Brendan as well as with Lauren, to high-risk sexual behaviors that could have potentially been avoided with parents or providers. Have these have benefited them if these conversations were had earlier? What are best ways to inform the medical community on the importance of creating a better support for sexual health conversations with individuals, as well as how do we get that started?
Well, I'll say that certainly I hope that my career, that I will spend most of my time trying to educate others when I can. I'll humbly say I'm not sure where, if I'm making a huge difference. I mean, part of the joy of my practice is I love my practice, but I essentially act as I draw patients from all over the community to our practice because we have special accommodations and maybe a little bit more experience with things. But that means that other providers are essentially allowed not to provide those same services. So I've really struggled whether the goal is to have a bunch of specialized centers or whether the ideal, the dream of the ADA is that we have accessibility in every place for every person, kind of all the time. And it seems reasonable to me, but in reality, I understand that it's still quite a dream. So we continue to try to educate people, but unfortunately the best educators are going to be patients. And you are all really experienced with receiving healthcare. I always tell other providers that you can see straight through a provider um, that's a little doubtful or trying to make it up as they go, because you've seen it happen before. So I think I hate to like point it back towards you, but like I think that education will start with individuals that have the greatest story. And I mean, your story is exciting and wonderful, and everyone's is in their own way. And so I think that ultimately the strongest thing is not with evidence or PowerPoints, but it's meeting people and seeing their lives.
I would just echo, and with time, I don't want to continue too much, but I think it's really important to continue to advocate for our patients. And I think one of the best joys of my career is similar to John's, in that the patients just lift you up so much, and caring for people and being able to show them what their bodies can do, and having the experience that we have shared together is just one of like the most special parts of my job. But that said, I humbly also say that like I'm not sure, that I had any kind of specific training that was better than anyone else's. I continue to just advocate and get patients to come to me who hear about us and what we provide in the community. And so I think, we need to start at medical. Was it Linda that was saying earlier? I mean, medical education just has to be revamped. I mean, the fact that we don't have disabilities as part of the curriculum. At UMass, I teach kind of an interest group on caring for people with disabilities. Like, that's not okay. It's the people that already have that heart and soul and passion who are advocating for more education who I'm speaking to. Those aren't arguably the problem, but they can hopefully be part of the solution. But I do think that it's important to start there and hopefully gain a little bit more knowledge there, and then continued practices who advocate for places that are more comfortable for everyone to receive care, because that is the goal, is that everyone receive the level of care that they deserve in the healthcare system. And that should be what we all fight for. It's just really hard, and there's many struggles. And if I had the answers, I wish I did, but I think we just have to keep going, and we have to keep fighting. And this platform is so strong and so important. It is tough to hear some of the situations that have been less than ideal as a healthcare provider. It's hard to hear the struggles and feel like, wow, we really need to do better, but we have to hear that. Everybody has to hear that so that we can do better. And so part of it is things like this, part of it is advocacy, part of it is medical education, but I think one of those alone is never going to be enough.
Yes, great answers. Yeah, it makes me reflect back on how important it is to have community, like all these small pieces that have to come together in order to get the ball rolling. And it starts with conversations like such as this one that we're having right now. So thank you. So this one's for Dr. Long-Bellil. So based on your research, what current health disparity gaps do you notice regarding pregnant women with spina bifida? Like, for example, like few providers having knowledge, as you mentioned before, accessibilities to certain rooms that Lauren's mentioned. Like, what other gaps do you feel like it's imperative to like talk about right now or to address so that people that are aware of?
Well, I think that there are ongoing access issues for sure. But also I think that there needs to be more clinical knowledge about what are some concerns, some potential risks that women with spina bifida should be aware of, and that their clinicians should be aware of. Dr. Courtney Shepard-Strohr, who is at University of Michigan, has done a handful of studies on this and come up with some very interesting findings about potential risks, but also finding that, that it's not, how do I explain this? That the risks are not nearly as great as people imagine they probably are. So I think both of those things, but establishing that really it is quite possible to have a baby when you're a woman with spina bifida and have things go fine, but that also there are these specific kinds of risks that in a small number of cases might come up. So I think some more clinical research and more dissemination of clinical research, I think, would be very helpful. to give people a more realistic picture.
Yeah, thank you. Thank you. Yeah, I absolutely agree. I think it's important that this conversation not only stays here, but it gets shared so that other people are more aware of what's going on. Because I think what happens is that it becomes like this daunting task where it's like, it's not that difficult as you mentioned, but the more we create some sort of like normalcy with it, then that way the changes can be made. So thank you. So for the last and final questions, this is pretty much a question that all of you all can answer. I kind of wanted some more insight and also a look into the future. So what do you hope to see in the next 5 to 10 years regarding research in terms of broad education that was mentioned, medical training, access to providers, and equitable healthcare settings regarding fertility, reproductive, and sexual health with individuals with spina bifida? And also, what advice do you get? Do you hope that it would change in the future in terms of that? So anyone can answer. So feel free to jump in or like raise your hand and then I'll call on you. All right, so Lauren's hand went first, so I'll do Lauren and then Dr. Harris and then Kristin.
So in terms of research and education, medical training, all that, I mean, I hope in the next 5 to 10 years, it's easier to find a doctor that's actually experienced and not kind of just going with it, hoping for the best, and we're kind of their first patient or one of their first patients with spina bifida. And like I said with my story, like I feel like some things that happened during the C-section could have been avoided had they been educated, or maybe even I maybe would not have gone into labor, needed an emergency C-section. And so there definitely needs to be a lot more education, like we've talked about, and advice for people planning to start a family. Just research. There's so many groups like on Facebook now. Talk to other people. I wish I had talked to other people, but I feel like I didn't know there were groups. I don't know if there were that many groups like 8-9 years ago when I was first thinking about it. Like I didn't know where to find people for parents with spina bifida, and talk to different doctors. And I think like I felt comfortable with who we went with, but looking back, I definitely wish we had asked more questions, maybe talked to more doctors beforehand to really be better prepared for what we encountered.
Really quickly, certainly our group and our hospital and our healthcare system, we're trying to do a better job of reaching out to women in other settings other than, say, a women's health clinic. So trying to provide some educational opportunities for people when they're going in for, a primary care visit with their neurologist or their urologist. These are, places where, men and women with spina bifida may be going there, and they may be up for a little bit of extra education. So we have some telephone opportunities for people for education and conversation. I think one of the next really exciting things for me for my patients is just social media is really, really powerful in this space. And so there's just some great communities. Certainly, I think the one that I hear the most about is Wheel Mommies on Facebook. Just having a really large community of people that are, living with, wheelchair mobility and parenting and being mothers and families. And that's just a really powerful experience that is just like much better than talking to, some doctor. So I'm excited about the future.
I have so many things in my mind right now that are spinning around, but I think in the next 5 to 10 years, as much as I'd love to see more educated physicians around to help me or anyone, I'm not sure that will happen in the very immediate future unless we do talk about it more. And people really, this all stems from people not being comfortable talking about mental health, sex, fertility, and disabilities. All of those words are things that no one wants to talk about. still to this day, and it drives me crazy. So this is such an amazing opportunity to be a part of, and I hope that everyone talks about it more. We can make shed light on it more, and then we'll see some real changes. And I think for advice for people who plan on starting a family who have a disability, I think making your own team essentially is what I had to do. Finding a neurologist that would work with my MFM and so on and so forth. It's a lot of work. It's a lot of trial and error. It's a lot of making sure you're comfortable with these people, but that would be the very first thing I would do, and probably the most important.
Excellent. Anyone else have any hopes for the future?
I just want to add one piece that Amy said that really struck with me in my experience as a father, is being prepared for that conversation with the child who is desperately trying to get into the conversation here off my left shoulder about what your disability is. She's 7 now, and I can't tell you how many times I've had that conversation with her. And the great part is the 7-year-old or younger, they're really accepting and they move forward. But at the same point, you have to continue to educate and update and have that. And that was one I've explained my disability, countless times to people in life and what have you. Being prepared to talk to your own child about it, that's one you're not often prepared. And I don't think I would have ever been prepared, and I'm still probably not prepared today, even though I have it quite often. You want to say hello now?
Mm-hmm. Oh, she's so cute.
Hi.
Say hi.
Hi.
Thank you for joining us tonight and letting your dad be with us. Well, I just want to say thank you so much to all of you. This is a tremendous conversation. Akira, thank you so much. Again, the work that you've done in a short amount of time on behalf of this organization is really tremendous. And it was your work that allowed us to pull this all together. Dr. Harris, Dr. Leftwich, Dr. Long-Bellil, thank you so much for the work that you're doing. You hopefully are helping to lead other medical providers to learn more, to specialize more, and to be those educated medical providers that all of our adults are looking for. And to my incredible board members, I can't thank you enough, time and time again, for your willingness to share your stories, to be so candid and so open about what your experiences are. I think that's just so helpful for everybody in our community who is watching and having these same questions. I will put in a shameless plug for the fact that we are having an education conference in October in Nashua, where we will be talking about this topic and so many others, including, we touched on it a little bit tonight about being a person with a disability and as a parent, managing those complications or considerations. What is the experience like for siblings of children with spina bifida? What is the experience like for spouses with individuals with spina bifida? We'll have all of those conversations and more. So and now we have Oliver too. So we have so much beautiful representation of the wonderful journey that you can take to become a parent. And we all know that it may be challenging, but it is absolutely well worth it. And so we have no better evidence of that than these cute little faces right here tonight. So I just want to thank all of you again. This is a really difficult conversation, but a really important one. And I think every single time that we have it, as you said, Dr. Leftwich, we start to normalize the conversation, and that's as much as we can do in any one event or experience. But I thank you so much for helping us to do that tonight, and for your time and for your experience. So thank you. I will turn this off.